Hello, this is Dr. David Green with the California Pain Network. The topic today is the basics of celiac plexus blocks. Well, what is a celiac plexus block? It's an outpatient procedure used to relieve the pain from abdominal conditions such as pancreatitis, cancer, Crohn's disease, inflammatory bowel disease, and more. It can also help provide a diagnostic information, so it really does serve two purposes. It can prevent the nerves of the abdominal plexus from transmitting pain signals to the brain. The celiac plexus is a bundle of nerves that sits in front of the diaphragm, in back of the stomach, and right around the aorta and surrounds the celiac artery. So it's a large plexus of nerves just in front of the aorta. It supplies sensation to the liver, the spleen, the stomach, the pancreas, the kidneys, part of the bowel, and a lot of blood vessels as well. So it really does have a large sensory supply. Who does well with a celiac plexus block? Well, when a person is having pain from one of the abdominal organs, the celiac plexus block may relieve this discomfort. And as we talked about pancreatitis, pancreatic cancer, upper abdominal cancers, really any chronic abdominal pain may benefit. The celiac plexus block is an outpatient procedure. The patient lays prone, so face down, and can receive local and or IV sedation. Two separate needles are typically utilized with image guidance, which is fluoroscopy. This is actually a CT scan, just to show you how there's one needle that's put in on this side and one in on the other. And what you can see here are the bony aspects of the spine. These are actually kidneys. So the needles are put in, then typically some dye is injected, so the doctor can see exactly where the tip of the needle is. And then when it's accurate, the steroid and numbing medicine are pushed in. And maybe even some phenol, which is a type of alcohol that can give longer lasting pain relief. Are there risks with the procedure? They're small but real. There's always a risk of infection, nerve injury, bleeding. That's why patients are instructed to stop taking their anti-inflammatories about a week before, so that the bleeding aspects are minimized. There could be an anesthesia complication such as an allergic reaction. And if the needle is misplaced, it can result in a collapsed lung. Another transient complication could be hypotension or diarrhea. What are the outcomes of celiac plexus blocks? Well, a study in anesthesiology years ago showed that 3/4 of patients receive excellent pain relief from these injections for all types of chronic abdominal pain. That's actually a very, very good result. Oftentimes a series of injections is necessary with a procedure every few weeks. And these procedures can often reduce the need for opiate medications. Opiate medications are not fabulous for abdominal pain, so thankfully this procedure can help reduce the need for what is being taken. The California Pain Network offers the top non-operative pain management with affiliated clinics throughout the state, including San Diego, Oceanside, Orange County, LA, Bakersfield, Inland Empire, all the way up to San Francisco. The clinics accept over 50 insurances, with over 25 treatment options being provided, and the overall success rates exceed 90%. The doctors are board certified and award winning, and they frequently offer both medication management along with interventional procedures such as the celiac blocks. Visit us on the web at californiapainnetwork.com, and then call us at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.